proud to be here today, standing with our SAVE partners. That's the Sacramento Alliance for Vaccine Equity, our community leaders, our advocates, Mayor Steinberg and Councilwoman Valenzuela, to be here today to say that the city must lead to ensure all of our employees are vaccinated. As many of you know, I represent a district with the highest cases of COVID in the city and in the county, zip code 95823. And over the past months, 42 weeks to be exact, I've had the opportunity to work closely with 20 organizations in standing meetings, weekly clinics, strategizing and re-strategizing to ensure we do not leave our hardest to hit communities behind. This powerful coalition of over 20 organizations serving Sacramento, our trusted messenger, has been working incredibly hard, addressing all of the barriers that we know it takes to make sure that our community is vaccinated. SAVE has been working hard to break barriers, cultural and language barriers, digital barriers to vaccination for our families and our residents throughout Sacramento. But when our city employees who work directly with the public are not vaccinated, it threatens our collective efforts and undermines the health and safety of our entire community. As a city, I believe that we must lead. While our community partners are on the ground advocating for vaccinations for our most vulnerable residents, we too must take responsibility for ensuring that our own city staff are vaccinated. With more than half of our public safety personnel unvaccinated, that means that our frontline defense has no defense. We must do what we can to protect the public of our community. This Herculean task to protect our community cannot be done by one entity, but we can start that today by ensuring that all city employees receive the COVID-19 vaccination to keep our community healthy. Today, you'll hear from my colleagues and community partners why a city mandate must happen to ensure we can protect the public health and the safety of our community. I'm honored to introduce our next speaker, Councilwoman Katie Valenzuela.
Good morning. My name is Katie Valenzuela. I'm the council member for District 4 here in Sacramento. Last weekend, I got the call that nobody wants to get, that my nephew, who's turning 8 tomorrow, had been diagnosed positive with COVID and was symptomatic. He got it from an in-home health worker who was there to perform services due to his autism. My nephew's nonverbal. He can't take care of his daily needs, and he needs people to come into the home every day to help my sister and her husband take care and teach him how to live. My sister, who's a frontline healthcare worker who's been fighting in Bakersfield this entire pandemic, a few days later was diagnosed with a breakthrough case. And now her husband, the one who stays at home to take care of the kids every day, has been diagnosed as well. This is unacceptable. They took every step to protect themselves and protect their family, and were exposed by someone who was supposed to be there to help them, to take care of them. And this is why I support the mayor's mandate for city workers to get vaccinated. Our frontline workers, particularly our fire and police department, are interacting with the public every day. We know what that means if they're symptomatic or if they're asymptomatic. We know what that means in a time of a Delta variant that is more contagious. We know what that means when the hospitals are filling up. And we must do everything we can to protect our constituents because we are public servants. So I'm here today to support the mandate and to encourage everybody in the city to get vaccinated. It is the one way we know we can protect ourselves and others. And we are only going to get out of this pandemic if we do it together. So now I'm happy to introduce our Mayor Darrell Steinberg.
Thank you very much, Councilmember Valenzuela. I'm very appreciative of your and Councilmember Vang's leadership and the leadership of the SAVE Coalition, not only in putting this event together, but Councilmember Vang, for many months now, this has been the site and the location where you and the SAVE Coalition have ensured that thousands of people get vaccinated. As you said, it's a Herculean effort, and you and the coalition are leading the way. At the same time, it is shocking, frankly, to see the statistics when it comes to vaccination rates for our city employees, especially our public safety employees. We must show the way. We must lead the way. Yesterday, I wrote a letter to all of my colleagues asking that we impose a mandatory vaccine mandate for all of the council offices and all the charter officers. And uniformly, they have said yes, without hesitation. Public safety. We all believe in public safety. But those who constantly preach the importance of investing in more public safety need to see this health crisis as public safety and help lead the way. Everyone needs to get vaccinated in the city. And certainly everybody who holds the public trust and who signs up to be a public employee, especially a public safety employee in the city, needs to get vaccinated. Period. End of story. And we're going to do all we can to protect them and to protect the public and to make sure that happens. I loved what my friend Aziza Davis-Goyne said last week in a meeting, the head of the Sacramento Black Chamber of Commerce. She said, and I repeat for myself, I'd rather they all be mad at me than be dead. Get vaccinated. Stop it. We can get beyond this and we can resume the communal life that we all long for. Get vaccinated. Please. Thank you. Let me now turn it over to our friend, community leader, Pastor Les Simmons. Pastor Simmons, there you go.
Again, I'd like to recognize Mayor Steinberg's leadership and Councilwoman Vang and Katie Valenzuela as well for their leadership, and everyone standing alongside for standing together to say we want to protect the lives of Sacramentans. We want to not only encourage but mandate vaccinations. As a pastor of South Sacramento Christian Center and a part of the SAVE Coalition, we've been on the front lines of both addressing support through equity for vaccination and testing and food as well, but also on the front line as a pastor doing funerals for individuals. And like Councilwoman Katie Valenzuela talked about, getting that call from someone that a loved one or a member of a church has contracted COVID-19 and died. 2 weeks ago, I got one of those calls. A young man named Man, 32 years old, that contracted COVID-19 and died, and people needed help for the funeral. These calls have continued to come in. Bottom line, vaccination saves lives. Get vaccinated. As a result of the Delta variant, we've seen a full increase of positive cases. Our site runs a community test site weekly with our SAC Collab collaborative, and we've seen 1,000 people come through the line to get tested every single week. This is very real. Many of us remember 2020, March 2020, and when the pandemic first hit, and the level of urgency and emergency and all the questioning around where's the vaccination? Well, it's here. It's been here. The time to act is now. We not only encourage it, we stand fully in support of the mandate, and we're asking all community leaders, community-based organizations to follow as well. I now want to take some time to introduce Zoe Vang. Let's welcome her as she comes.
My name is Zoe. I am a resource coordinator at Montagues and Barons United, and I'm also a community member in the 95823 area. And my family has also been impacted from the COVID-19, and I truly believe that it's important to get vaccinated because vaccination is just one of the most key important levels of protection for family and the community. So I think it's really important that we come together to really, as everyone is getting vaccinated, as all the community is like opening up for like schools and businesses and just organizations, it is very important that we all get vaccinated, as this is a very key level of protection for everyone. And yeah, it's very important that we get develop this community immunity so that we have a safe, that we can actually come back to a very safe and healthy community together. I would like to welcome next Megan Sapigo from Sacramento API Network, Regional Network.
Hello all, my name is Megan Sapigao, and I am the co-executive director of the Sacramento Asian and Pacific Islander Regional Network. And we are one of the community partners with the SAVE Coalition. SAVE stands for Sacramento Alliance for Vaccine Equity. For the past year, the amount of time and energy and anxiety and tears and hustle, these community members, these faith-based organizations that we have put into connecting our most vulnerable members to vaccines has been indescribable. In my community, the Asian and Pacific Islander community, we faced and overcame a multitude of obstacles and barriers when it came to getting vaccines to our communities, including lack of trust, limited language access, limited digital proficiency, even transportation barriers. But we fought. And it was because of this community full of strong, compassionate leaders like Councilmember Vang, her team, the incredible volunteers, this powerful coalition, that we were able to connect vaccines to those who struggled the most to get them. I was once thanked by a community member who attended one of our very first clinics here, and she was with her mom, her elderly mom. And she cried to me and she said, "I didn't think my mom was ever going to get vaccinated. We were running out of hope. You have no idea how many lives you are all saving right now." But the work continues. So I want to thank the city leaders here today for demonstrating brave, bold leadership. And you know, it's, as this virus has claimed a catastrophic number of lives, traumatized families, children, and elders, and effectively changed the landscape of whole families and communities. I mean, we've lost breadwinners in our households. We've lost elders who are pillars of our community to this virus. Families have fallen into massive debt over medical treatments. And I know personally folks who have lost businesses that have been around for generations in their family. And as we stand here, while life-saving vaccines that are proven safe and effective are in abundance being offered right behind us for free, to me, it seems absurd to even call what our city leaders have to do right now bold and brave. Demanding protection for the lives of the public during a deadly public health crisis should not be considered bold and brave. To get vaccinated and to protect the lives of our community should be the easiest decision we could make. So thank you, Mayor Steinberg. Thank you, Councilmember Vang. Thank you, Councilmember Valenzuela. And thank you to these incredible folks who give their time and energy to protect this community that we love so much. I would like to call up Rachel Rios with La Familia.
Thank you. Thank you, council members and mayor and community partners for being here today. My name is Rachel Rios. I'm the executive director of La Familia Counseling Center. And our organization has also had to make the difficult decision to mandate testing for all of our staff. It wasn't an easy decision because we do respect people's ability to make decisions and choices for themselves. But we also recognize that we have a responsibility to the community and to the clients that we serve to make sure that they are safe. I want to address the folks that have concerns and hesitancies about the vaccinations. We know that there are some real concerns that people have, and we do not want to shame and blame those people. We want to offer information and education. We offer you to call any one of our community clinics, and the community health workers can provide you accurate information about the safety of the vaccinations, or we can also connect you with a healthcare professional that can answer your questions. I also want to address for those people who want to get vaccinated and are unable to because they have underlying health conditions. All of our community centers have testing available, as Pastor Sims talked about. So we have regular testing every day of the week to be able to get those folks that want to be tested, that want to be vaccinated, that are unable to get tested, so that they can provide the safety to their community and to the public that we expect them to do. We know that there are many hesitancies about getting vaccinated. The Latino community has carried the brunt of this pandemic. If you look at any of the demographics, they have had the highest rates of COVID cases as well as the COVID deaths. And many of the challenges in having vaccines have been access, as was previously talked about, and language barriers. And many of it has also been trust. So we want to let the community know that we as community partners are here to alleviate those concerns, to give you accurate information so that you will be vaccinated, so that you will be able to protect your family and your friends. And we know the power of influence. So for those of you who have been vaccinated, you are influencers. You can tell your family and friends what they can do. You can tell them the truth about the vaccines. And so we have started a referral program. If you bring someone to be vaccinated, you both get an incentive, because we know that the power is with people who you trust, those individual connections. So thank you again to our leaders for making this mandate. Thank you.
I'm sorry. I want to introduce our wonderful Betty Williams.
Thank you. I'm Betty Williams. I'm the Executive Director for California Hawaii NAACP, where I represent 57 branches. I'm also the President of the Greater Sacramento NAACP, where we have been fighting this war, this epidemic from the very beginning. When it hit our town and all over the world in March, one of the things that the NAACP did immediately was to start making masks. And we had our citizens, our senior citizens, doing that because at the time, our community didn't have masks. They came later. And then soon after that, there was the testing sites, and we did the education for the testing sites and made sure that people received testing. And then I was doing advocacy work and trying to make sure that we had vaccines in the community. We stand here at 95823 in a zip code that has the highest positivity rate when it comes to the COVID. And it's hitting Black and brown at a rate that we shouldn't be standing here saying that this is a brave statement to make sure that our servants, our employees, our fire and police should be doing this. They work for us. They should be supporting us. And so they tend to be in this zip code most of the time. And so we want to make sure that if we're calling for help, that they're not bringing in diseases to our community. In addition to that, we want to make sure that we educate our community when it comes to the vaccine and the testing. The NAACP has a website, like many, where we have allowed people to get the information, the telephone numbers, the referrals, where they can get testing. Probably 30 minutes prior to me coming here, I had to pray with one of my executive committee members because a close friend of hers is in the hospital now on a ventilator due to complications of COVID. While she's in the hospital, her son received COVID and he died while she's in the hospital. So she's dealing with the death of her son. She's fighting for her life in a ventilator. And so we are here standing together in collective voices, pleading with our servants that should be protecting us to make sure that they get vaccinated. And that's why I'm standing here in support of the mandate. And Mayor Steinberg said something from Aziza that I said, I'm okay with people getting mad at me. I'm okay with that if it saved one life. We should not be dying over something that we have the ability to make sure people do not die, to make sure people don't get sick. We are already at the NAACP fighting with myths and people who are hesitant, who don't want the vaccine, who are saying that this is, in lack of a better word, a game to get us in to kill us. And then I'm sitting here, we're educating. We're going back and we're literally holding hands and knocking door to door to make sure our folks get vaccine. We're doing all of this in our community to make sure they get vaccine. And yet I stand before you with the other leaders saying, why aren't our civic servants getting vaccine? They should be. If we are doing all we can, they should be doing all they can to make sure that our community is safe when it comes to this COVID. We must get tested. We must get educated, and they must get vaccinated. This is not an option. And so I encourage everyone that hears this, that they go back, and I'm okay, and they say, Betty Williams from the NAACP is supporting a mandate. You're absolutely right, I am. If I can fight for our Black and brown and everyone in the community to make sure that they get vaccinated, I want to make sure that our public servants do the same thing immediately. We can't wait on this. And so I thank again my council person, my Vang, for making sure this happened. Because I tell you, when it first started, prior to my Vang, the prior council member, when I went to them, I'm gonna put it that way, and I said, where are the vaccines for our community? And the remarks was, they can go to any emergency room. It's versus coming to the community. But this young lady made sure that it happened. Our council members made sure that it happened. And we want to make sure that it happens with our public service. So I am proud to introduce my council member, where I also live in the 95823, and I also want to be protected by those public servants. If I give the call for them to come to my door, for them to be vaccinated as well, I'm introducing my council member, my Vang. Thank you.
Thank you so much, Betty. So at this moment, we'll take any questions from the public. I don't know if there's any questions online. At the same time, we'll also want to invite our mayor to come up here as well, and Councilwoman Valenzuela to come up as well, just to take on any questions. Oh, okay, okay. Mayor, do you want to take that one?
So we respect the negotiation process, the so-called meet and confer process, and our city is in the process of negotiating with all of the exclusive representatives for police, for fire, for supervisors, for our miscellaneous employees. We are pushing our insistence that all city workers be vaccinated very, very hard, and we're going to continue to do so. And we're going to sit and try to work it out with them and try to convince them that this is the right thing to do. So I'm going to hold off on what happens if they don't agree, except to say that our community and our leadership, our city council has unanimously insisted that our city employees get vaccinated. How would I characterize those negotiations? Well, I would just take the public comments from some of the union leadership. They don't like it. They believe it's a choice. In fact, they've said that very clearly. This is not a choice. It's not a matter of individual choice. You know, your individual choice stops when it runs headlong into the public health and public safety of thousands of people. And I just want to repeat, and I want Maya and Katie to speak more than I do, please, because I really do.
I have put a statement out that I don't think we should be negotiating life and death matters. This is about protecting the public health of our communities. And when you have public safety officers who are coming into the homes of our elders, right, that are immune compromised, it is so important to make sure that our city employee, our workforce, is vaccinated. At the end of the day, for me, this is a life and death issue, and we shouldn't be negotiating life and death matters when we know we have to do everything we can to protect our communities. As I mentioned earlier, for the past 42 weeks, several months, our amazing faith-based organization, community organizations on the ground, diverse coalition has been working so hard to make sure that every single resident in South Sacramento, in the city, is vaccinated. And if our employees are not vaccinated, that undermines our collective work to truly protect our communities. And so we all stand here today supporting the city mandate because we know it is about saving lives. And this is the reason why it's so important.
We have a question from Chris Hooks with Cap Radio. If union leaders say no, what happens next?
We follow the law. We respect the law. And so I can't answer that question, except I think my answer is I think the implicit answer is pretty obvious. We are insistent and will do everything within the law to ensure that our city employees are vaccinated. You cannot be for public safety and tout public safety every day of the year and say that protecting the safety and the health of the people you serve is a choice and an option. So what happens next? We are going to respect and follow the law and the collective bargaining process. Yeah, the city council employees are immediately covered. Exactly.
First off, I think we cannot allow our privileges of different regions to impact society in a way that leads to continued death. My faith calls me to protect life, preserve life, and the vaccination does that. As a pastor in a community of a very large church and also a part of a larger group, our goal is to protect and serve, to uplift, to provide resources, as we've always done, and not live in our privilege. As Christ did, he put himself on the line for the people he loved. And that's what this moment calls us to. That's how come even tomorrow, we will be providing a vaccination pop-up from 12 to 4 at our church. I don't know what churches have done throughout the last 18 months, but I know my faith calls us to create space that's safe and not create space that's spreading the virus. And by doing so, we're doing vaccination, COVID testing, and we'll continue to do that.
I have a follow-up question from Chris from Cap Radio for the mayor. Would the law allow you to enforce the mandate regardless of the union leader stances?
Under the law, under the collective bargaining law, after a good faith negotiation, if it results in an impasse, the employer has the authority to unilaterally implement their proposal. We are insistent that our public employees get vaccinated.
Thank you.
Okay, thank you. Thank you.
Good, thank you for coming.
All right. Well, thank you so much. Our faith-based community leaders and advocates will be here to take any questions. And again, we all stand here in solidarity to make sure that the city moves forward with this mandate. Thank you.